This is Christiane Sheldon. I am doing this project for Nutrition 230, and it is November 2021. I decided to do vitamin D deficiency and susceptibility to psoriasis. And the reason I chose this is because I was diagnosed with psoriasis several years ago, and I've done a fair amount of research into it, and it's just a question that I wanted to ask and see if there was any kind of link, because I have done or seen some studies that have questioned whether vitamin D deficiency and psoriasis are connected, as some psoriasis patients do show a deficiency in vitamin D. So my research question is, does vitamin D deficiency contribute to a person's susceptibility to psoriasis? So background on psoriasis, it's an autoimmune disease, which means basically that your immune system is attacking itself. There is no cure for psoriasis at this point. Psoriasis is also considered an inflammatory disease because in moderate psoriasis, levels of inflammatory cytokines, such as TNF or interleukin-2 and interleukin-3, are increased, which results in chronic inflammation throughout the body, including in the heart, the liver, the kidneys, the intestines, and the muscles. And this is interesting because a lot of people who know about psoriasis or who can see somebody with psoriasis, because it presents on the skin, think that it's just something on the surface, but it's actually stuff happening below the surface too, not just the autoimmune part, but the inflammation as well. And this also makes people with psoriasis at higher risk for cardiovascular disease and kidney disease as well. So psoriasis causes skin cells to regenerate up to 10 times faster than normal. So the skin cells don't have time to fall off, and this leads to a buildup of skin cells. Normally, skin cells regenerate about every 28 days or so. So this is pretty fast, and that leads to the skin just building up on top of itself, and that's what you see of the plaques of psoriasis. The skin cell scales usually develop on the elbows, the knees, the hands, the feet, the neck, the scalp, and the face. So pretty much everywhere. It's believed to be caused by genetics or possibly some environmental triggers, including stress, some medications, skin trauma, such as sunburn, or alcohol abuse. And this little picture on the side just shows some different types of psoriasis. The one that I've been diagnosed with is the erythrodermic psoriasis. There's some different reasons that are listed there, and some treatments. Usually by the time that you get to the biologic medications, which I'm fortunate enough to be on, you've had to go through several other treatments before that to qualify for the biologics. There's some commercials on TV for those, such as the ones for Cosentyx or Tremfya. So why bring vitamin D into the picture? Well, as I mentioned earlier, there have been some studies that have shown a possible link between vitamin D and psoriasis. After all, vitamin D is synthesized through exposure to UVB rays, ultraviolet rays from the sun. It's synthesized in the skin that way. And just connecting that to psoriasis, perhaps there's some kind of connection. So to answer this question, though, also we have to get to know vitamin D a little bit. So it's one of the fat-soluble vitamins, along with A, E, and K. It's known as a sunshine vitamin for the reasons I mentioned previously, with its synthesis from exposure to the sun. It's present in some foods, such as egg yolks and salmon, but it's not present in a lot of foods. So for that reason, it's added in others such as fortified orange juice and cereals. And it's also available in supplement form. The recommended daily value for adults is 600 IU. It can also be absorbed through the skin naturally, as I mentioned, by exposure to sunlight, especially when the sun is strongest in the summer months for us in North America. So some of the functions, once vitamin D is activated and absorbed in the body, one of its most important roles is to work in conjunction with calcium. I think that's where a lot of people relate it. It promotes calcium's absorption, which assists in bone growth and strength. So together with vitamin D and calcium, those two together can help prevent rickets in children and osteoporosis in older adults. But here's where I find the connection to vitamin D and psoriasis. So vitamin D has other roles in the body, including its role in reducing inflammation and regulating immune functions. So these are functions that are faulty with an autoimmune disease such as psoriasis. When the skin is injured, as in the lesions on the skin's surface that develop with psoriasis, it takes a higher amount of vitamin D intake to help enhance healing. And also, as inflammation goes hand in hand with psoriasis, the loss of anti-inflammatory properties of vitamin D could suggest another explanation why vitamin D deficiency may contribute to a susceptibility to psoriasis. And vitamin D deficiency and psoriasis. So vitamin D is fundamentally connected to the skin for its synthesis and metabolism. It regulates many physiological processes in the skin, including skin proliferation, which is the regenerating of the skin cells, and differentiation, which is the movement of keratinocytes upwards from the basal membrane. The basal membrane, it's adjacent to the basement membrane. There's several layers in the skin. So the movement of keratinocytes upwards from the basal membrane toward the surface of the skin. The keratinocytes are a responder to vitamin D's active form. They're the only cells in the body that can synthesize vitamin D from its precursor 7-DHC, and are also necessary to make vitamin D into its active form, 1,25-OH2D. Nutritional deficiencies and a rapid loss of nutrients, especially vitamin D, from the proliferation of the superficial layer of skin has been associated with severe psoriasis. Some studies have shown this. Vitamin D's role in proliferation of skin cells, as well as its role in modulating the immune system, have shown that adequate dietary intake and oral supplementation of vitamin D can be an important option in the treatment of psoriasis and represents, I believe, an unmet therapeutic need. This picture just shows vitamin D's metabolism, like from the sunshine, the UVB rays, and its activation in the liver and the kidney. The precursor is vitamin D2, and the active form is vitamin D3. Just gives you a little bit more information on that. And the little caption says the schematic outline of vitamin D metabolism and mechanism of action in psoriasis. So it's just kind of outlining that a little bit. So the evidence that I found, vitamin D deficiency and how this affects the body has shown some correlation with psoriasis occurrence in some studies. How? Well, vitamin D deficiency can occur from malabsorption. It can occur, which might seem obvious from low vitamin D intake, but the reason for this is it's kind of easy to do because not many food sources have it, as I mentioned earlier. So some foods are fortified with vitamin D. And it's because that so many foods are lacking in it. It can also occur from a lack of exposure to sunlight and also by taking certain medications. So in psoriasis, white blood cells called T helper lymphocytes have become overactive and produce excess cytokines. This triggers inflammation in the skin and some other organs. As mentioned previously, the inflammation inside that also occurs with psoriasis. There have been a few studies that have shown that vitamin D suppresses the production of interleukin-2, interleukin-3, and interferon gamma. Those are some powerful cytokines that stimulate immune responses, such as inflammation. While it's known that the use of topical vitamin D is effective in treating psoriasis plaques, another study suggests that vitamin D3 supplementation may be important in the prevention of psoriasis-related comorbidities, such as hypertension and metabolic syndrome, because it has a higher efficacy in raising serum 25-OHD levels, and that's a serum level that's been shown to be significantly lower in those with psoriasis than vitamin D2. And just as a side note, the serum 25-OHD level is considered to be the best indicator of vitamin D status when a blood sample is taken. So my conclusion is it should be considered that low 25-OHD levels can either represent the cause or consequence of psoriasis due to lack of exposure to sun or low intake, interference from certain medications, or poor nutrient absorption in the small intestine. Since vitamin D plays an important role in skin and immune health, it would make sense that supplementation through food or orally would benefit those suffering from an autoimmune disease such as psoriasis that affects not only the skin but also causes many underlying issues, including inflammation. Some of the study results that I looked at did confirm reduced vitamin D levels in those with psoriasis compared with the healthy controls of the studies, thus providing new evidence regarding the association of vitamin D levels and psoriasis. And while some studies have shown the beneficial use of vitamin D supplementation to treat psoriasis and metabolic syndrome due to its anti-inflammatory properties, the studies unfortunately do not show enough evidence to connect low vitamin D levels and susceptibility to psoriasis and will need further study. And I just included this last picture to see some of the causes of vitamin D deficiency, as well as some of the associated diseases. And I wanted to highlight that one of those autoimmune diseases is psoriasis.